In this video, we are going to be looking at the thrombus. When we say the thrombus is simply a vital part of the body's response to injury, preventing excessive bleeding and promoting healing. Here we have a picture of injured blood vessels. When a blood vessel is injured, the body responds to prevent excessive bleeding by simply plugging into what we call the platelet. In this picture, we have what you call the blood vessels, and this red one are what you call the platelet, and these ones are what we call, this is the red blood cells, RBC, and here we have the platelet, this platelet. What happened immediately after this platelet are being plugged? The platelet aggregate to the site of the injury, forming a platelet plug to temporarily stop the bleeding. The moment those platelets manage to stop the bleeding, coagulation cascade begins. When we say coagulation cascade, this is when the platelet triggers a series of chemical reactions activating the clotting factors in the blood. Immediately those factors arrive, thrombus formation begins. In this case, the fibrin mesh traps blood cells, platelet, and other substances, creating a solid blood clot which we call the thrombus. But notice that if a thrombus forms unnecessarily or fails to dissolve, it can cause serious health issues, such as blocking blood flow to the vital organs, which we call embolism. And second thing it can happen is causing stroke or heart attack. In this diagram, if you can see it, here we have what we call the red blood cells inside the blood, which are bioconcave, and here we have the decrease of blood flow due to the thrombus which we have here. And here we have the vessels, because we said it normally happens when the vessels get injured. So in simple words, you can say the thrombosis or the thrombus is like a blood clot that forms inside the blood vessels, kind of like a pump, like a lump, that block the normal blood flow. Because here we have the normal blood flow, which we have a lot of numbers of red blood cells, but as it moving, here we have few numbers of red blood cells because of this thrombus that forms in between. By now, we are all wondering, why does this usually happen? Thrombi can form in different parts of the body, like the legs, which we call the DVT, which is deep vein thrombosis. And it sometimes also happens in the lungs, which we call the pulmonary embolism, in short form PE, also in the heart and the brain. Here we have a typical example of the thrombi in the brain. Here we have the red blood cells, and here we have a lump or clot which block the flow of blood inside the brain. If you notice here, we have the platelet and some other, substances, which make it kind of more like a ball. And here we also have the one in the lungs, which we call PE, which stands for pulmonary embolism. And the last one, we have the DVT, which is common and potential life-threatening condition that can be seen in vascular surgery, is the formation of blood clot in the veins, which we call the DVT, deep venous thrombosis. This simply occurs when blood clot form in deep veins, typically in the legs, and here we have it in the legs. You can zoom it if you want. So obstructing the blood flow, blood back into the heart. While anyone can be affected with this, certain risk factors such as immobility, surgery, pregnancy, prolonged traveling in planes or in cars, and some certain medical conditions can increase likelihood of developing the DVT. We had been talking since about thrombosis. Now let's look at the problems which this thrombosis can cause, or thrombus can cause. If a thrombus gets big enough, it can block a blood flow in the vessels where it forms. This can cause a lot of serious problems like pain, swelling, difficulty in breathing, heart attack, or stroke, depending on where it happens. What about the treatment? In this case, doctors usually use medication called anticoagulant to prevent blood clot that forms inside the blood vessels. Anticoagulant medications like the warfarin, heparin, aspirin to prevent clot growth and new clots. Sometimes they decide to use thrombolytic tissue plasminogen activator, and sometimes in some cases surgery may be necessary to remove the clots or repair the damage of the blood vessels. So this is it for this problem. I hope you find it helpful. If you do, please don't forget to give us a thumbs up and subscribe to my YouTube channel. Thank you for watching. See you next time.